So when I explain to people that I advocate for psychedelic assisted psychotherapy, I usually get a little bit of a double take because they heard psychedelic and then they heard therapy and they're like, wait a minute, how does that go together? Well, let's go ahead. Let's talk about it. Hi, everybody. My name is Jill. Welcome back to the Journey Sage. And this is the channel that I wish had been around when I was going through psychedelic assisted psychotherapy to heal my childhood trauma induced PTSD. And so to just dive in and explain what psychedelic assisted psychotherapy is from the very, 100 level, think about it as combining a psychedelic with a therapeutic protocol. Well, what does that mean? That means having some sort of established therapeutic relationship or entering into a therapeutic relationship in order to work with a psychedelic at some point. So what did that look like for me? Well, if you've been following my channel, you know that I was diagnosed with PTSD due to childhood trauma, and my therapist at the time was working to become a psychedelic assisted psychotherapist. And so I kind of fell into this therapy. I already had a pre-existing therapeutic relationship, and then we were adding a psychedelic in because my talk therapy and my antidepressant Wellbutrin wasn't making a dent in my symptoms. So what did it actually look like? Over the course of a year, I went through a cycle 3 times, and this is what each cycle is: 40, 20, 40. 40% of each cycle is the talk therapy component, the time preparing for the psychedelic journey, the time where I'm figuring out what my intentions are. I'm asking all the questions about what that day is going to be like. I'm asking, what if I do it wrong, or how will we know that it's working? And also kind of diving a little deep into my symptoms. For me, I was incredibly hypervigilant. I was just overrun with fear. So really narrowing down my intention setting for that day. Why am I always so scared? How do I get rid of this fear? Where is it coming from? All of those kind of questions. The 20% is the actual psychedelic day. That's the day where the prescribed psychedelic, as per the diagnosis, so in my case, MDMA for PTSD, is actually given to the client or the patient, whatever your terminology you prefer. And that can last anywhere from 5 to 8 hours with a client or a patient being in an enhanced state. The therapeutic component here is very, very important. Having trained practitioners or facilitators, because a client's mind or a patient's mind, or my mind, if you want to look at it in terms of my experience, my subconscious was wide open. And so making sure I had trained, trauma-informed people, my therapist and my guide, who at the time was a medical doctor, supporting me and helping me through the really tough emotions. I mean, it was, for me, one of the very first times I was blatantly honest about my fear of my father, and didn't get poo-pooed or didn't get, oh, he's your father, it's okay, or, oh, it couldn't have possibly been that bad, or like what my aunt had said once, what did I do to deserve it? Things like that. The practitioners who are working in the therapeutic space are trauma trained, and ideally really extensively trained working with psychedelics. The last component, the last 40%, because it was 40 prep, 20 the actual day, and then the last 40, is what's commonly called integration. And that's basically where the brain's neuroplasticity is open wide. And what that means for a trauma patient is that I was able to look at childhood memories and see them from an adult perspective and shift my opinion and my emotions. So for instance, a 230-pound, 6'2" man beating on a toddler, I was able to shift because of the neuroplasticity enabled by the psychedelic from the idea that I wasn't lovable or I was too much to, hey, wait a minute, that adult man really had a problem. So that neuroplasticity time during the integration process is invaluable for making lasting healing changes. So what we're talking about with psychedelics in a therapeutic modality is completely different than recreational. There are goals here, there is a tremendous amount of support and training, and there's just the extensive talk therapy that is really required to help somebody fully prepare and fully integrate. Now, the second kind of way to define psychedelic assisted psychotherapy is the actual state in which the client or the patient finds him or herself during the actual 20%, during that psychedelic day when a patient is taking the medicine. And I'm purposely using that general term because psychedelics are being studied for PTSD, depression, addiction. There's a ton of clinical trials that are happening and getting started and being planned and things of that sort. So that's why I was kind of general with that statement. When a client or a patient is in that enhanced state, that means that his or her subconscious is kind of wide open. It's an opportunity for the default mode network. You know, that network, like when you're driving and you're kind of on automatic and you don't really know how you made it all the way down the highway, or you're cleaning the house and you're on automatic. That automatic kind of status quo thinking, that gets shut down for a little while. And it allows the brain to make connections and talk to other regions of the brain that normally doesn't happen. I'm going to show a graphic of a brain in an enhanced state versus a non-enhanced state. You'll be able to see pretty clearly how many different connections get made when a client is in that enhanced state. That journey state or that psychedelic state is when the medicine allows a client or a patient to see a whole bunch of connections that he or she wasn't able to see before. And in my case with MDMA, I was allowed to finally get close to some of the fear I had about my father that I never would have voiced or never really would have admitted because, like, oh my gosh, my childhood wasn't that awful. So that enhanced state is a huge, huge delineator between regular talk therapy and psychedelic assisted psychotherapy because the practitioners have to be very, very careful and very aware of anything they say or anything they do because the client or the patient's subconscious is wide open, kind of like a sponge. It will just kind of like absorb everything. So the practitioners need to be highly trained in terms of understanding trauma, in terms of understanding how to act during the time period when a client is in that enhanced state. So it's a little bit of an advanced skill set for the practitioner too. And then third, right now, when we talk about psychedelic assisted psychotherapy, we're talking about it very specifically as per a diagnosis, quite frankly, because that's where the clinical trials are. So walking into your therapist and saying, oh, I just really can't figure something out, or I'm really bothered by something, unless there's a diagnosis right now, it's kind of challenging to even think about using a psychedelic as a healing modality in the United States and within a therapeutic relationship. It's happening all the time at retreats in other countries and things of that sort. But in the US right now, psychedelic assisted psychotherapy is really being targeted towards specific mental challenges, primarily because that's what the clinical trials are, designed to do. They have to have a focus, they have to have a clear intention. So MDMA for PTSD, psilocybin or magic mushrooms for anxiety. LSD actually just got FDA breakthrough therapy designation for anxiety. Iboga or ibogaine, an extraction of iboga for addiction. Everything is kind of the research has us very much looking at specific mental challenges. I think that's going to change as we move forward. We're going to see a lot of overlap, but that's how things are now. And if you're looking at psychedelics and you're saying, I think that enhanced state with a great practitioner could help me, but you're not necessarily dealing with the past or trauma. Past and trauma is therapy, future thinking, future goals, kind of getting unstuck. That's more of a coaching paradigm, and that is not specific to a particular mental health diagnosis. So there you go. I think that's my basic level 100 explanation as to what psychedelic assisted psychotherapy is. You think about the addition of a studied psychedelic with an established therapeutic relationship and you mesh them together, some phenomenal trauma healing can occur. And so if you're interested in hearing more about my story of overcoming childhood trauma with MDMA, my memoir, Rescuing Jill, and companion workbook for attention settings, they're both on Amazon. You can always head to thejourneysage.com. I've got a bunch of resources. I've been on a ton of podcasts. You can hear my whole story. And so with that, until next time, take care.